Hi everyone, this is Dr. Khutbuddin Ali, your eye doctor. So I want to share this video to send a message to all my medical colleagues, at the same time awareness among the public regarding a recent incident that happened at one of the eye hospital. So media has reported in such a way that because of doctors' negligence or even in a harsher way, the local media have reported that the doctors have taken claim of a 6-year-old child's life. So the headlines was so catchy in a negative way, definitely, that it sent so much of outburst among the normal public and a negative message upon the doctors. So I would like to give a brief account of this case. So it was a case where a 6-year-old child got injury with a wooden stick. So she was examined at a hospital, then referred to the main hospital for eye surgery. The doctors have advised that surgery is a must for them, and they have advised that a short acting anesthesia, general anesthesia, which is given for children, so that was advised. Because of the anesthesia related complication, which was very well explained before the procedure, the child had some severe complication and she was referred to a pediatric intensive care unit. But the message that definitely there was some mistake on the part of the doctors had spread among the patient relatives. They have made sure that the doctors have made a mistake, and the message among the public was so outrageous that they have totally distracted the hospitals, have attacked the staff in duty, everything, without knowing the actual facts. But when once the total facts were discussed, this was the basic scenario. So it is a question, two things. One, to the media, is it right on your part? Is it true journalism? Is it honest journalism that what you are doing? What is your duty as a fourth pillar of democracy? What you have to do? You have to spread the facts, you have to spread awareness. But what you have done, fine, you have given some amount of advantage towards the patient relatives, but at the same time the negativity that spread upon the doctors is something which cannot be taken easily. So the negativity spreads very fast. First thing, as a doctor, any doctor, not just me, it is so much sorrowful that the life of a child was lost, which rarely happens. It is done because it is a modern medicine. There are complications, there are adverse effects to a medicine, and these are all the things that have been already explained to the patient, and the patient is a child, to the attendants and relatives. But in spite of all these, when such things happen, so it is understandable as a doctor during the career of most of the doctors, because of the situation, because of grief of losing your dear ones, sometimes it happens that you outburst, you scold the doctor, you just have some discussion, some argument with the treating persons. But this sort of behavior definitely has a long-term negative impact on the healthcare sector. Once this happens, if you go to the Western countries and other things, there's a definitive protocol where everything is explained. At the same time, how to handle such cases, it is dealt in a very documented way. In India, cases like where there is a high volume of cases, if such mishaps happen, if the patient attendees have attack on the doctor and hospitals, in future, I don't think any doctor would like to take up complicated cases. Yes, as doctors, we do have the urge to treat complicated cases. But if this is the scenario that prevails, it is a worst case that can happen for the healthcare sector. No doctor will be taking any risk to take complicated cases. Everybody will be interested to take the lighter cases where you don't have much risk, where you can easy money. It takes years and years for a doctor, lot of hard work, lot of experience, lot of struggle, study, clinical evaluation, and lot of clinical seminars they have to attend to gain the clinical skill. To treat a complicated case, it's such a risky thing. It doesn't give any extra leverage to the doctor. It is only to benefit the patient that they have taken such a risk. And these are the documented, these are the established adverse effects with anesthesia related complications are the procedure in some cases, not in this case. So the patient, the relatives, and especially the general public have to understand this. If you start believing whatever the media is saying because of any reason, because as I told you earlier, The negativity spreads much faster. If it is happening, it is a loss. It is a loss to both medical fraternity, to the public too, and more so to the public. So I hope this message reaches to everybody, and when such things happens, the whole medical fraternity is shattered. So I think when this thing happened, had there been any complicated cases at other hospitals, definitely they might have hesitated to take up such a case. This should not happen. In medical and emergencies, time is money. Time is the most precious thing. If the doctors or medical staff use the time, take more time to think whether to take up this case or not, fearing the risk of backlash from the patient and its relatives, in the very rare case scenario, such things will waste the precious time. And believe me, definitely whatever is intended to have a proper good care, it cannot be provided. It is a humble request. After all this happened, still the doctors have never said that they will not treat the patients, not take up the complicated cases. We just as humans, with so much of hard work, skill, dedication and passion, we have come into this profession, and please understand the scenario. Yes, we are with you. Such things happen. It is a sad part on any family too, but please trust your doctor, support your doctor, believe in your doctor, and just follow the advices. And both things, you have to follow the precautions, you have to follow all the protocols. And one thing to my medical fraternity friends, document everything properly. Don't think that you know this patient from long time, or there is no proper time to have all the details. These can be done once the surgery has happened, everything. No, all the details have to be documented properly, irrespective of the severity of the case. Explain once or twice. Sometimes it happens that the patient might not understand the medical terminology or the English terminology. So explain them in their vernacular language, documented it, and if possible have a video documentation too. That only can save you. It's a humble request to the public. Just don't blindly believe what the media says. They are there to project the facts, not this pseudo facts and negative things. Thank you, and please spread the message and support your doctor. Thank you.